May Allah bless and keep you safe, keep you safe. May Allah bless and keep you safe. May Allah bless and keep you safe, keep you safe. May Allah bless and keep you safe. Bless and keep you safe. Bless and keep you safe.
Sallu ala al-Habib sallallahu ta'ala ala Muhammad sallallahu ta'ala alayhi wa alihi wasallam. In this clip, we will try to learn how to give first aid to someone who is choking. This indeed is a very frightening experiencing for anyone who has to deal with a victim of choking. Generally speaking, it happens with children, and today we've got with us Zain Ali, a Madani Channel, who we would like to demonstrate upon that if someone is choking, how to give them first aid.
May Allah bless and keep you safe.
Assalamu alaikum wa rahmatullahi wa barakatuh. Zain Ali, how are you?
We are fine.
Thank you. Jazakallah khair. Children can swallow all sorts of things which can cause them to choke. So when someone is choking, they will usually have their hand on their throat and they will be coughing to try to get whatever is in their throat out. The best thing is for them to keep coughing. Ask them, keep coughing. Zain Ali, keep coughing. Now, if you realize that the patient is not able to cough it out and they're getting tired, then what you need to do is deliver what we call as back blows, up to 5 back blows. Now I would like to demonstrate how to deliver effective blows so that it helps whatever is in the throat to come out. For back blows, it is very important that you get the patient in the right position and you keep reassuring them. Zain Ali, you're going to be fine. I need to help you to get this out. Okay? So I will actually try to hit you at the back. Okay? So if you turn around, what we need to do is we need to get the patient in that position, support them with your right hand so that they don't fall, and you need to get your leg in front as well, that just in case if they fall, then you are in a stable position to hold them. And the back blows are delivered between the shoulder blades and in this motion, like a bow. Don't do this because this does not give enough. Don't do just this because this is not the effective way of giving back blows. So what you need to do is with reasonable force, obviously depending upon the size of the patient, with reasonable force, come in this manner and hit and then move forward. 1, 2, 3, 4, 5. Up to 5 blows. If whatever is stuck in the throat comes out, you stop. Now, if the 5 back blows are not effective, then we need to deliver abdominal thrust. For that, you need to get the patient standing up. Zain, if you could stand up and just look that way, you get behind the patient and your face should be on their shoulder. And what you need to do is, you need to make a fist and you need to place that fist between the belly button and the bone and in between that area. So that's the bone up there, that's the belly button. Put the hand fist there, then the other hand on top of it. You need to fully support your own body as well. And then what you need to do is, the way you need to deliver abdominal thrust is that you first push your fist into the abdomen and then pull it up. So in and up with a reasonable force for up to 5 times. And if what is stuck in the throat comes out, you stop. If it does not after 5 abdominal thrusts, you then repeat the cycle again. You need to deliver up to 5 back blows.
May Allah bless and keep you safe. Bless and keep you safe.
And then again abdominal thrust, and hopefully it will come out. If after one cycle of 5 back blows and 5 abdominal thrusts, the stuck item does not come out, then someone needs to call the ambulance. And until the ambulance arrives, you need to carry on with this cycle of up to 5 back blows and up to 5 abdominal thrusts. Now, very important information about delivering abdominal thrusts. When we do deliver abdominal thrusts, there is a risk of injury to the internal organs inside the abdomen. So what you need to actually do is, you need to tell the patient that once they have recovered from the choking episode, they need to seek appropriate medical help. And remember that a child less than 1 year of age, you are not going to deliver abdominal thrusts.
May Allah bless and keep you safe. Keep you safe. May Allah bless and keep you safe. May Allah bless and keep you safe. Keep you safe. May Allah bless and keep you safe. Bless and keep you safe. Bless and keep you safe.